Hello, I'm Peter Okwacho. Welcome to Focus on Africa. Our top stories. Just 63 days. That's how long it's taken 17,704 people across the African continent to get infected with coronavirus after the first case was confirmed in Egypt. And with the continent's resources redirected to fighting the pandemic, fears are emerging that existing crises could get a whole lot worse. We'll explore whether suspensions of essential childhood vaccination programs could lead to looming health emergencies further down the road. And with food security already under severe stress due to poverty, conflict and climate change, we'll ask whether coronavirus is making it harder for the most vulnerable to feed themselves. Thanks for joining us here on Focus on Africa from BBC World News. We do apologize for coming to you slightly later than normal. The coronavirus pandemic has now reached almost every corner of the continent. That's the stark assessment by the World Health Organization's head of Africa, Dr. Matshidiso Moeti. There are now well over 17,000 confirmed cases on the continent, as well as the impact on health. The economic outlook is looking grim, as Ferdinand Omondi reports from Nairobi. The African continent is limping from the drastic effects African countries have had to take to limit the spread of the coronavirus. Shutdowns, lockdowns and curfews have directly affected the continent's largest revenue streams in industries like tourism, export and the oil sector. It is about to get worse. The World Bank says the continent is likely to witness its first recession in a quarter of a century, and that a third of Africans who have jobs may lose them.
Beginning with the farmers who are unable to plant, leave alone sell their produce, the distributors, and here it's not just logistics, but think about shops that are closed, restaurants that people used to go to consumers. We often forget that many people were feeding or getting food in their offices, children in schools. Overall expenditure at the household level has dropped. And so there's a squeeze also in terms of food supply, making a food crisis a big concern.
The coronavirus pandemic has now spread across the continent with over 17,000 confirmed cases. The World Bank and IMF now say they support the plea by African finance ministers to get a debt relief so that these funds may be freed to combat the effects of the coronavirus. And the WHO says that America's decision to withdraw its funding to the organization will directly affect this continent and the gains made in the health sector.
So the impact potentially of this decision will be quite significant on areas such as polio eradication. We're on the way to having a declaration of certification of polio being eradicated from Africa.
Meanwhile, African countries are finding alternative ways to sustain themselves. Countries like South Africa and Kenya are now turning their industries into supply chains for personal protective equipment to combat the coronavirus. Countries like Rwanda have already spread out relief for the needy people in the community. And now Kenya has also said it has identified the needy people in the capital Nairobi who will start receiving weekly stipends. Kenya's COVID-19 fund has now approached the $10 million mark, mostly from donations. Ferdinand Omondi, BBC News, Nairobi. Well, one problem with all the focus on the COVID-19 outbreak is that millions of children around the world are missing out on essential vaccinations for other deadly diseases. That's the warning from the World Health Organization, who say 117 million children from 37 countries are missing out on the potentially life-saving measles vaccination this year, as mass programs are paused. And this could have dangerous long-term implications for many countries. Vaccine-preventable diseases include but are not limited to measles, polio, whooping cough, tetanus, diphtheria, meningitis, yellow fever, hepatitis B, tuberculosis, pneumonia, and cervical cancers. It's estimated that about 3 million children under 5 years of age die each year in Africa, and a significant number of these deaths could be prevented by vaccines. Yet, 1 in 5 children do not receive them.
24 countries, including several already dealing with large measles outbreaks, have decided to delay because of the coronavirus pandemic. These include Nigeria, Chad, Somalia, DRC, Ethiopia, and South Sudan. Well, to discuss further, I'm joined by Professor Beate Kampmann, who works with the London School of Hygiene and Tropical Medicine. Thanks for joining us, Professor. What happens if these children born this year do not get their vaccinations?
Yeah, thanks for having me on the program. This is a really very important topic because on top of what is an epidemic of measles in some of these countries, we're now seeing the pandemic of COVID-19, and it's a really important issue to pick up now. So children, especially young children, are very vulnerable to measles. And if there is a lack in immunization in the overall society, for example, we see this in areas in Nigeria, then measles outbreaks are almost a guarantee. And that could be a really awful combination.
And I understand that some of these very first vaccinations that children get after they're born, a few days after they're born, are not exactly carried out by so-called medical workers, but by workers from NGOs. So in these days of social distancing, how are those affected?
So I think it's independent of whether the vaccinations are carried out by NGOs or by EPI systems in most countries, actually. The social distancing throws them some challenges. And I think the sooner they get on with giving life-saving vaccines to children in places where we don't yet have a big corona outbreak, the better it would be. And that's why I'm a little bit disappointed that these mass campaigns are now going to put back on the back burner, because there was a big target for measles elimination in many countries. And for example, we saw the impact of that in Ebola-stricken DRC. There were 3 times as many people died from measles as did end up dying from Ebola. And I think people just need to be a bit more imaginative about how they can now deliver these vaccines in still safe circumstances.
Let's talk about being imaginative now. We now know what the problem is. Have you got any suggestions about solutions?
So what we've seen here in the UK, where I'm based at the moment when I'm not in West Africa, is that, this is not a setting for rural areas necessarily, but people have arranged green zones in vaccination areas where only people who have no evidence of any COVID exposure will be seen. Families, we have had drive-through vaccination clinics. We can possibly do social distancing by people staying apart in vaccination clinics. Clinics could be timed very carefully. And actually, I think the EPI system could deliver a great deal of public health messaging around the COVID epidemic.
Professor Kampmann, I beg your pardon. Thank you very much for joining us here on Focus on Africa. It's much appreciated. Now let's go to Brazil, which has the highest number of confirmed cases of COVID-19 in the Southern Hemisphere. Currently about 29,000. And while more than 1,500 people have died, minimal testing and a struggling healthcare system means the country could be massively underreporting the number of cases. And President Jair Bolsonaro is still publicly playing down the impact of the virus. The BBC's Kathy Watson has more.
Laid to rest in difficult times, grieving families have to bury their dead quickly and safely. Gravediggers are taking no risks as the pandemic takes hold. For those left behind, there's little comfort at a time when it's needed the most. This was not the way Sandro ever imagined saying goodbye to his mother. Maria Odeci died of suspected coronavirus, like so many being buried here today.
I'm really sad and worried about the situation. I wasn't taking it too seriously before. I didn't really believe it. I thought it was the media stirring things up. Then, when it happened to our family, we understood the severity of it.
Latin America's biggest graveyard is getting busier, but they're bracing themselves for the weeks ahead. The peak isn't expected until May or June. The municipalities bought 5,000 body bags, gravedigger Manuel tells me. They've hired more people too, as they get ready for the situation to get worse.
Workers here say they're digging around 50% more graves than they normally would as more burials come through here. And of the people who died of suspected COVID-19, They're being buried, many of them, without getting official test results. Families have to wait days, if not weeks, for them, which means that the official number of deaths here in Brazil is not an accurate representation of how many people are dying now.
Brazil's laboratories have a backlog of tens of thousands of cases to test. The country is also struggling to import sufficient quantities of ingredients for testing as the whole world competes for supplies to tackle the pandemic.
All we see is the top of the iceberg, because now at the moment in Brazil we test only the patients that go to the hospital and then go to and stay there. So we know only the more severe cases, but we don't know exactly how the virus is circulating in the population.
Experts fear that with a president who continues to flout health guidelines, people will stop heeding advice such as social distancing. But this is a time when the country needs it the most.
People ask me when we're going to reach the top, when people can relax. But anyone even guessing is being hasty, because we can't estimate how the curve is going up. Imagine you're climbing a mountain, but you can't see the peak. And that's why it's important to look at the rise. Will we be similar to US, to Italy? We don't know. Not with the data that's available.
But the burials don't stop, and neither does the heartache. Behind the statistics, family members are lost, with loved ones wanting answers as to how they died. Katie Watson, BBC News in Sao Paulo.
Let's take a quick look at other stories related to coronavirus making headlines across Africa and the rest of the world. The human cost of the coronavirus outbreak continues to mount around the world. Global infections passed the 2 million mark on Wednesday. Just over 140,000 people are now known to have died from the disease, but over 500,000 have been able to recover. A 28-year-old Ghanaian nurse has died in England after contracting coronavirus. Mary Ajapong, who was pregnant, died on Sunday and was described as a fantastic nurse who devoted her life to the National Health Service. Her baby was delivered by emergency cesarean and is said to be doing well. And nearly 200 South African schools have been vandalized, set alight or burgled since the country went into a nationwide lockdown 3 weeks ago. Most of the schools that have been targeted are in Gauteng province, the country's economic hub. Nearly 50 people have been arrested for their alleged involvement. And more people have been killed by security forces enforcing the lockdown in Nigeria than have been killed by coronavirus. That's according to the country's official human rights body. So far, only 12 people have died from COVID-19, while a report from the National Human Rights Commission found that there have been 18 deaths as a result of law enforcement. This is Focus on Africa from BBC World News with me, Peter Okwoche. Still to come, we'll explore fears that coronavirus will make it even harder for the most vulnerable in Africa to eat. I'm Peter Okwoche. Welcome back. Now, as the coronavirus continues to spread across Africa, it increases fears of worsening food insecurity for a number of countries. Africa is, after all, the continent worst affected by food insecurity. Beyond poverty, climate change and conflict, the problems also have badly exacerbated by locust swarms that have descended upon East Africa this year. Well, for more on the impact of coronavirus on food insecurity, I can now speak to Dominique Bourgeon, who is the Director for Emergencies for the Food and Agriculture Organization. He joins me now live from Rome. Dominique, just how serious is the potential impact of coronavirus on food security?
Well, thank you for having me on your program. Of course, we are very concerned with the impact of COVID on food security. First, of course, because of its impact on the health of families and of their labor force, but then due to a number of disruptions along the value chain from production, when it's basically more difficult for farmers to access their land due to some of the containment measures, but also it's more difficult for them to access agricultural inputs such as seeds and fertilizers. Then suppose the food is produced, it's even also difficult to transport the food from producing areas to consumption center. And when it reaches the consumption center, people, for many depend on the informal economy for their income, find difficulties to access the food, to pay for the food. So it means there is a number of risks along the value chains that lead to potential issues in terms of the impact on food security.
Okay, so I just mentioned the swarms of locusts in East Africa that we've seen in the last 6 months or so, but which areas on the continent are most at risk?
Well, as you say, I mean, globally, at world level, we have over 120 million people who live in acute food insecurity. 70 million of them on the African continent are in severe acute food insecurity, meaning the most extreme form of hunger, the type of food insecurity that requires humanitarian assistance and where people have to cut on the quality, quantity of meals, as well as sometimes resort to sell their belongings. Now, in terms of the hotspots, you rightly say, with a very bad situation with the locust upsurge. And then, of course, we are very concerned with the situation in the Sahel that is also affected by a mix of climate-related extremes and, of course, insecurity and violence, particularly around the Lake Chad, the Mali, Niger, Burkina area, as well as northern Nigeria. Then, of course, DR Congo, which is the largest food crisis in Africa, and then a number of countries in Southern Africa that are facing, of course, again, impact of climate extremes as well as some economic crises.
So Dominique, if I may just come in here, I mean, it seems to me, just listening to you, it seems to me as if you're in some sort of a catch-22 situation because, yes, the world has to deal with this coronavirus pandemic, and yes, we have to provide food for those people who need it the most. What is the solution? Are you seeing any interest from the donors to provide enough for these people most at risk?
Yes, of course, everybody is very concerned. And basically I mean, even if we do not see yet a massive impact of coronavirus on food security in Africa, there is a clear risk of food crisis within a health crisis. And therefore, government, first and foremost, are very concerned for the well-being of their population. Therefore, we work with them very closely to monitor the situation and be able to trigger action. Now, there are two types of actions that are most urgently needed in most part of the African continent, especially in the Horn of Africa as well as in the Sahel. The planting season is ongoing in East Africa. We need to make sure it happens. It will soon happen in the Sahel. And then later in the year, the planting season towards September, October will start in Southern Africa. We need to support that.
Dominique Bourgeon from the Food and Agriculture Organization, thank you very much for talking to us here on Focus on Africa.
Thank you.
Now, across many countries, health workers have borne the brunt of the coronavirus outbreak. In Egypt, they make up about 13% of all infected people. Doctors have been pleading for more protective medical kits to help deal with the pandemic in largely overwhelmed medical facilities. The Arab world's most populous nation has reported over 2,000 cases so far, and the WHO says death rates, which stand at 7.6%, are high. The BBC's Sally Nabil reports from Cairo.
Caution is in the air in this Egyptian public hospital. Safety measures are tightened, and patients were cleared from the room as disinfection gets underway. But medical staff across the country are very worried about their own health. Dozens of them have recently tested positive for coronavirus. We spoke to a doctor in a public hospital who didn't want to be identified.
Two of my colleagues complained to their supervisor about the lack of surgical masks. Shortly after, they were rebuked for spreading rumors. 2 weeks later, this supervisor tested positive for coronavirus.
This is the country's main cancer medical center in the heart of Cairo, before it became a hot spot for coronavirus. Over a week ago, nearly 20 medical staff were infected. Officially registered coronavirus cases suggest that the infection rate has not spiked yet. But even before the country gets to this grim milestone, doctors are warning there isn't enough personal protective equipment or medical tests.
It's meaningless to save the protective gear for later lest things get worse. This is what spreads infection. Doctors or nurses suspected of testing positive should be quarantined at once.
According to the World Bank, there is nearly 1 hospital bed for every 1,000 Egyptians, and local statistics say there are around 2 doctors for every 1,000 patients. Life in Cairo is more or less business as usual in the morning, but the bustling city comes to a standstill at night due to a nationwide curfew. Egyptians haven't seen the worst of coronavirus yet, but with a population of over 100 million and a poorly funded healthcare system, the scenario can be scary if numbers swell. Sally Nabil, BBC News, Cairo.
And that's it on Focus on Africa for today. Don't forget you can get in touch with me on social media. I'm at Okwoche. But from now, from Focus on Africa, from me, Peter Okwoche, and the rest of the team, thanks for watching. Goodbye.